If you've been told you need to have a procedure, maybe it's a knee replacement, chances are you've thought about where to go. But for the longest time, there wasn't a simple way to figure that out. Well, there's a new online tool that calculates your individual risk and identifies top performing hospitals for your procedure. Here to explain how it makes more informed decisions possible, Dr. Arkell Georgiou. Good morning.
Good morning.
So this new tool, it sounds intriguing. How does it work?
Well, what the Healthgrades Risk IQ tool does is it gives you your personal information about your unique risk when you have certain surgeries. So we cover 6 different surgeries. You can use the Risk IQ tool for total knee replacement, total hip replacement, hysterectomy, open heart surgery, bariatric surgery, pacemaker replacement, common surgeries. The reason that it's so important to know your personal risk level for any of these surgeries is that every single surgical procedure, no matter how commonly it's done, will have a certain level of risk associated with it. It could be a simple complication that you get over. It could be as serious as death. But the risk that each of us has is different based on our age, our sex, our past medical history. So by entering all of that information into the Risk IQ tool, the calculator can tell you immediately whether you specifically are low risk, average risk, or high risk. And then it takes the next step and it tells you the closest 5-star hospital, high quality hospital with the lowest complication rate, lowest mortality rate, where you can get that surgery in your area.
That's amazing, because you see like news headlines and you think, oh gosh, well I don't know, but it was never really simple before. How easy is this? Because you're talking about a lot of data. I guess it's already included through the website, but then as patients, we're also inputting quite a bit there, I'm guessing. So the simple factor here, how would you rate that?
Well, Healthgrades has done all of the hard work. We've collected all of the data from the federal government, put it all together to make an apples-to-apples comparison across all the hospitals in the United States, and we've put it in a format that's really simple for consumers to use. So we actually designed the tool and selected the procedures to make sure that it wouldn't take too much time at all, between 6 and 10 questions to answer for any single one of these procedures. And this is information that really you have off the top of your head. It really does range from age and sex, and then some of the medical conditions about yourself that you're probably already familiar with. And then you push enter, and it automatically calculates for you what risk category you fall into.
So the best way to begin taking advantage of this tool and selecting the right hospital for whatever, and like you said, it could vary patient to patient, procedure to procedure. So what is the best way to begin here?
Well, I think the important thing to highlight here is that the best hospital for you may not be the hospital that's closest to you. The best hospital for you that offers the lowest complication rates may be a little bit farther away. And so if you know your risk level, you can make an informed decision about whether or not you want to go the extra mile. So let me give you a specific example in Omaha, Nebraska. There are a lot of good hospitals in Omaha, and there are so many that only 26% of people would have to drive more than 5 miles to get a common surgery like a hysterectomy. But 77% of people would have to drive more than 5 miles to get that hysterectomy at a 5-star hospital like CHI Health Mercy. Council Bluffs is one of those hospitals. So if you know your risk, if you're going to have a hysterectomy in this example, if you're really high risk, that may be a very specific situation where you make the decision to drive a little farther to give yourself the best opportunity to have an uncomplicated procedure to have the best outcome.
I'm such a fan of this idea because I'm like a huge advocate for us as patients to take control and be as knowledgeable as possible when it comes to our health. So this is right up my alley, and I feel like our viewers are going to receive it well too. Give us the website one more time, doctor, then we'll let you go.
All of this information is on healthgrades.com, and the Health Risk IQ calculator is right on the homepage.
Great. Thank you.
Thank you.
And we've seen some crazy